Stop assuming colon cancer is mostly about genetics. That one belief keeps so many of us from seeing what we can actually control. Because this disease is showing up in people younger than ever, and it's not just bad luck or it runs in the family. The daily choices around food, movement, weight, smoking, and drinking shape your risk far more than most of us were ever taught. And if you or someone you love is already facing a diagnosis, I want to speak to you with real honesty. For colon cancer is serious. There's no sugarcoating that. But it is not always a death sentence. We now understand the biology better than ever. And for some patients, immunotherapy can wake the immune system up and help it recognize the cancer again. I'll come back to that in a moment. Because it also shows why prevention is one of the most powerful tools we have. Hey, I'm Dr. Hana. In my clinic, I hear the same heartbreaking line almost every week. Doctor, I thought I was too young for this. That's exactly why I'm making this video. Not to scare you, but to arm you with clear, practical steps you can start today, no matter what your age. Here's what we now know. Colon cancer rates in younger adults have been climbing steadily, and inherited genes only explain a small fraction of cases. Family history matters, of course. But the environment we create inside our bodies every single day matters even more. The food on your plate, the fiber you feed your gut, how often you move, whether you smoke, how much alcohol you drink, and how healthy your metabolism is, all feed the same pathways. Inflammation, imbalanced gut bacteria, a weakened immune system, and an environment that quietly welcomes tumors. Let's talk about the 5 habits that quietly raise your risk and what to do instead. First, stop making processed meats your go-to protein. Bacon, sausage, deli slices, hot dogs. These aren't just not the best choice. They're clearly linked to higher colon cancer risk because they promote inflammation, alter what reaches your colon, and usually push out the protective foods you need. Even if you only have a little, it's the pattern that counts. Your colon remembers the routine. Second, stop living on a low-fiber, low-resistant starch diet. This might be the most underestimated risk of all. Your gut bacteria are starving for fuel. They need beans, lentils, peas, whole grains, vegetables, and fruit. The foods we call microbiota-accessible carbohydrate. When those bacteria ferment fiber, they produce compounds like butyrate that literally repair and protect your colon lining while keeping inflammation in check. And let me say something that surprises a lot of people. Simply going vegan doesn't automatically protect you. I've seen vegan diets built on Oreos, fries, soda, chips, and ultra-processed snacks. That's not colon-friendly eating. The label doesn't matter. The actual food does. Third, stop letting sugary drinks and ultra-processed snacks run the show. This goes way beyond calories. These foods crowd out fiber, drive insulin resistance, and often travel with the metabolic conditions that fuel early onset colon cancer. If your day starts with a sweet coffee drink, includes packaged snacks, and ends with dessert, that pattern adds up fast, especially in younger adults. Fourth, stop accepting a sedentary, waist-expanding lifestyle. Sitting for long stretches, moving too little, and carrying extra weight around the middle aren't just about how your clothes fit. They're cancer risk factors. Physical inactivity and excess body fat create higher inflammation and poorer insulin control. Your colon lives inside your whole body. When the body struggles, the colon pays the price. Fifth, stop treating smoking and regular drinking like they're no big deal. Both directly damage your colon. If you smoke, your colon feels it. If you drink most days, your colon feels that too. I'm not asking for perfection. I'm asking for honesty with yourself. These are 2 of the highest yield changes you can make. Now, let me connect all of this to what's actually happening inside you, because this is the part that stays with people. Imagine your immune system as security guards walking through your colon every single day. Tiny abnormal cells appear over time. In a healthy body, those guards usually find them and take them out before they become dangerous. But when poor diet, chronic inflammation, smoking, alcohol, extra body fat, and a damaged gut microbiome weaken those guards, those abnormal cells can slip through. Then comes the second problem: blood supply. A tumor can't grow large without building its own network of blood vessels. That process is called angiogenesis. Think of it like a city trying to expand with all the roads blocked. Once the roads are built, growth can happen fast. This is why certain foods and lifestyle habits can make the environment less welcoming to tumors. Not because food is medicine in some magical way, but because every bite sends biological signals. And this same biology links prevention to treatment. Some advanced colon cancers respond beautifully to immunotherapy, especially those with mismatch repair deficiency or MSI high features. These drugs basically remove the brakes from your immune system so it can see the cancer again. They don't work for everyone, which is why biomarker testing is so important. If you or someone you love is facing this diagnosis, ask your oncologist if the tumor was tested for MMR or MSI and whether immunotherapy might be an option. Here's something fascinating. Your gut microbiome can actually influence how well immunotherapy works. People who respond better often have a healthier, more diverse microbiome. In studies, changing the microbiome changed the treatment response. That tells us your gut isn't just digesting food, it's training your immune system. This is why I'm so passionate about fiber. Yes, take antibiotics when you truly need them, but we need to stop casually destroying our gut ecosystem and expecting it to stay resilient. The hopeful news: the microbiome can begin to improve in as little as a few days when you change what you eat. So what should you start doing? Build your meals around the foods that feed your good bacteria and strengthen your colon lining. Make beans, lentils, peas, and whole grains a regular part of every day. Put a fiber-rich anchor on every plate. Oats or berries in the morning, beans or lentils at lunch, brown rice, quinoa, or farro at dinner. We're in polyphenol-rich foods too. A daily cup of green tea is simple and powerful. Tomatoes, cruciferous vegetables like broccoli, cabbage, kale, bok choy, and Brussels sprouts, and whole food soy like tofu or edamame all belong in the rotation. Use olive oil. Get omega, 3S from salmon, sardines, or plant sources. Lightly cook your cruciferous vegetables so they keep their beneficial compounds. A realistic day might look like oatmeal with berries for breakfast, a big vegetable bowl with beans at lunch, and salmon or tofu with broccoli and quinoa for dinner, with green tea instead of soda. It's not complicated, it's consistent. Remember, the overall pattern beats any single label. Don't get protection by calling your diet plant-based if most of it comes from a package. One last important note: lifestyle changes are not a replacement for screening. Risk screening now starts at 45 inches, the United States. Some of us need to start earlier because of family history. And if you notice rectal bleeding, unexplained anemia, persistent pain, or changes in your bowel habits that don't resolve, please see a doctor. Don't wait. Here's the simple takeaway: stop leaning on processed meats. Stop skimping on fiber. Stop letting sugary drinks and ultra-processed snacks run your day. Stop living sedentary with a growing waste. Stop smoking and downplaying regular alcohol. And start feeding your gut the beans, lentils, whole grains, vegetables, fruit, tea, and other real foods that lower inflammation and strengthen your defenses. That's how we make prevention practical and powerful at any age. If this video shifted how you think about colon cancer, share it with someone you love who still believes it only happens to old people. And tell me in the comments which of those 5 habits feels hardest to change. I read every single one, because your real life is what matters most to me. If you want more straightforward, doctor-led guidance like this, hit subscribe. I'll see you in the next one.